Good afternoon. My name is Stella Major. I'm a family physician and a faculty member at the Weill Cornell Medical College in Qatar. I spend my time teaching communication and clinical skills to medical students throughout the 4 years of the MD program. Additionally, I'm the director of the Clinical Skills and Simulation Lab at Weill Cornell and the Deputy National Representative to the International Association for Communication in Healthcare in Qatar. I'm a member of the SESAM's exciting SIM University team and also hold an advanced certification as SIM Health Educator with the Society for Simulation in Healthcare. I'm joined by my Dr. Kim Leighton. Kim, would you like to introduce yourself?
Hi, thanks, Stella. Hello, everybody. My name is Kim Leighton, and I'm the Executive Director of ITCON Clinical Simulation and Innovation Center, located at Hamad Medical Corporation here in Doha, Qatar. So our SIM Center is a purpose-built facility designed to provide education and training for healthcare clinicians across the system from all different specialties and professions. My background in simulation extends back to about 2003, and I'm also a member of SESAM and on the board of directors for Society for Simulation in Healthcare. And we're very pleased to be here with you today.
Thank you very much, Kim.
Stella, when I first came to Doha, you welcomed me into the SIM community and you invited me to be a part of planning your annual symposium. And I really appreciated the warm welcome that you gave me. I'm wondering, can you tell us a little bit about why you worked so hard to bring this small community together here in Doha?
My pleasure, Kim. Thank you very much for accepting to join our community. Maybe I can give a tiny context as our audience enjoys this very happy photo of the simulation team from our symposium in 2019. Since 2017, the Clinical Skills and Sim Lab at Weill Cornell has been expanded and upgraded. And at the same time, the Medical Education Division agreed to support support us in holding an annual symposium at the college. I've been serving as the Cornell Symposium CPD Scientific Committee Chair, and the members of the community, whom you see many of them in the screen, on screen in this photo, are an interprofessional body of health providers, health professions educators, and simulation technology operators who hold full-time leading roles in their respective institutions, but who are also supporting simulation-based education activities in their respective schools and institutions in Qatar. Some of them are members of the Qatar Simulation Consortium, and that was established well over a decade ago, and others are newer members who joined and are working with us in Qatar. The committee are all enthusiastic individuals and join me in working towards meeting the goals of supporting educational and professional needs of colleagues who are interested in and less skilled in sim-based education in Qatar. We are aware, what I'd like to do, thank you, Kim, for moving the slides on. This presentation reflects the theme of our third symposium, which was held in September 2019, and surveys from attendees from previous symposia indicated there was a clear challenge in engaging sim-based education into institutions. And this really led us to plan and devise a whole symposium to the theme of the culture of organizational readiness to adopt sim-based education. Kim, if I can turn to you, you developed and tested an evaluation instrument called the Simulation Culture Organizational Readiness Survey. Why did you develop the tool, and how do you hope it will be used?
Well, I developed the tool with one of my friends and colleagues, Colette Foisy-Dahl, who works at a sim center in Canada. And we both had done a lot of consulting and all over the world, but we kept seeing the same problems everywhere we were going. And we would find simulators in closets, we would find things in boxes. We went to schools and hospitals where there was no storage. They just didn't really know what to do with the equipment that they had. But when we really thought about what the the foundational challenge was, it was that really they weren't ready to embark on this simulation program. And so we thought, how can we help people, and specifically leaders, right, to understand what's required before you order the simulators? The equipment seemed to be the easy thing to get because a lot of places were able to use grant money, donations, things like that. But sustaining it was the problem. So Colette found a readiness tool for evidence-based practice, and we got permission from the authors to revise it for simulation. And the purpose of this tool is to evaluate the overall readiness of an organization to integrate simulation or to expand their simulation program. There's 5 sections on this instrument. One of them looks at the defined need and support for change. So, you know, does it fit with the mission of the organization? Is there leadership buy-in? Is the time right? What is the readiness for cultural change to support simulation? And what's the planning for time, personnel, and resources to support this program? That was often the biggest challenged area. And are there sustainability practices that are built in to this culture? Because when that grant money runs out or the donation is gone, how do you continue your practice? And then there's a summary impression. So all of these responses correlate to scores. And what you can see on this screen is just an example of one of those categories. And this is the time, personnel, and resource readiness. And if you were to imagine that all of the light green spaces were the average means of the responses, you can see that in particular, this group is challenged because they don't have fiscal resources for education for their simulation staff, and they don't have resources to develop a physical learning space. So when you look at how these means play out, it allows you to prioritize where to put your efforts. Now on the next slide, you can see how we did this at our conference. We had, this was pre-COVID, so we were still able to have small groups of people. We trained a leader for each of these groups on how to use and interpret the scores. And then we had our community as a whole completed this survey before they attended the conference. And we were able to collate the data and identify the lowest scored themes, which are listed on the slide. Then while we were in these small groups, we were able to get the community to discuss, you know, why are these things a problem? But more importantly, what can we do as a community to help advance the practice of simulation based on the results that we have here? Now, Stella, we had hoped to get some really great data from a follow-up survey a year after the symposium, just to see if we had made any progress, right, in affecting the change because of the symposium. And then COVID happened. And so we didn't get as much data as we had hoped for. But can you tell us what we did learn from the data that we did get?
Indeed. Thank you very much, Kim. Yes, so even though we had more than 100 participants, when it came to the 8-month follow-up survey, we were unfortunately only able to hear back from 15 members who participated. However, what's really important is that we see that, you know, given the disruption that COVID caused everybody, these 15 individuals did respond. And in answer to whether they'd used the SCORE survey or framework, the answer was predominantly no. If you could please turn to the next slide, we asked them to tell us what barriers they faced in terms of implementing their individual simulation-based plans, which they had provided as a kind of reflective thought at the end of the symposium. Now, these items are not new for this year. These are actually recurring items, and they were generated from previous surveys. We see an overwhelming impact of the change in priorities and work, which is what we expect, followed by lack of time, followed by lack of equipment and technology, and finances and staffing and expertise. But 2 things I want to draw to our attention. One is the lack of motivation, which in view of the huge turmoil we've all faced is something very significant to bear in mind. And if I may have the last slide, what I'd like to do is offer the following takeaway messages. We know that COVID has definitely challenged everyone in every possible way. It has definitely diverted people from doing what they used to do to the things that are priorities to meet the pandemic. And we also acknowledge that many of these barriers were pre-existent in the time of COVID, pre-COVID as well, and will certainly continue even after the effect. What I think is our goal as the simulation champions and leads for our community is twofold. One is to continue to maintain our link and support with our community to maintain motivation. And secondly, to develop accessible, affordable, and sustainable SIM-based educational training programs to meet the expressed skills gaps of our community. Would you like to add anything more, Kim, before we close the session?
The only thought that I had along the way was that one of the challenges with these takeaways is that we have to find the right time to do these things. So we know that our educators and our clinicians are on complete overload right now. And so to try to impact them with more education, I think we just need to caution to be cognizant of what their cognitive load capacity is and to choose our time wisely for reintroducing this.
Thank you for saying that. Given that we are now into the second, phase of our lockdown in Qatar, and so again, everybody has been, has been deployed to a number of different roles and responsibilities. So thank you very much, Kim, for sharing your thoughts with me, and thank you very much to our audience. I look forward to seeing you at the panel discussions during the symposium. Thank you.
Thank you, everyone.